Well, thank you, Victor. Well, let's get back to this. Bamsa is trying to be cheeky. He says President Jonathan didn't receive any baton. He fell to the ground and he picked it up. Speaking about handing over from one person to the other. But getting back to the statistics which you talk about, how important it is to our planning and development.
Yes.
But we see the country and we just seem to forge ahead, and one wonders, it means that most of those plans and actions that we're carrying out, they just do something and get some things going on. How come there isn't a lot more emphasis on it as it ought to be, or is there?
Well, you see, it's not as if you have people doing research, but the research is seriously underfunded and underutilized. But a way you can really understand what's happening is what is our investment in research. Take, for example, every government department is supposed to have the Department for Planning, Research and Statistics, which is supposed to track the indicators, right, that is relevant to the ministry or the government department in question. Because every government department is a service delivery outlet, right, for the entire nation. And what you need to do is that when whatever you need to calibrate whether you're actually delivering those services or not, as they affect the human beings, as they affect the population which you are covering, your jurisdiction. So it is these departments that need, unfortunately, a number of these departments are places where nobody wants to go because it's not. There's plenty of work being done in different states. I know in the Southwest and in the Southeast, there is plenty of work being done on creating this new understanding of monitoring and evaluation, because monitoring and evaluation is a very critical tool to development. It helps us to actually make the right decisions, you have the right options, both at any level, at the highest level of the presidency and the government, the highest levels of government, and at the most operational levels where we operate on our day-to-day business.
Well, you work in the field.
Yes.
You see how things are done. Let's look at the last indicator you gave, which is the gap between the rich and the poor. It is something that a lot of people acknowledge, leaders acknowledge it,
yes,
and they say that they're doing something,
yes,
to combat it, to bridge this gap.
Yes.
How would you rate the efforts so far?
Well, the efforts are, you don't want to stifle opportunity. There will always be people who will be very, very creative and do fantastic things and get financially rewarded for that. And there are some people who, for some reason, not because of their own fault, they will be economically disabled, if you know what I mean. And so, but the gap is wide, very wide, because there aren't enough social safety nets. You see, in any case, there is a limit to how much, where you make money to a certain extent, right? It only is necessary for you to think about ways of putting it back into the system. There's large opportunities for us to bridge that gap. There's corporate social responsibility, on the part of the private sector. There is the gap on ensuring that we give everybody access. You see, things like access to education, access to health. After all, what is poverty? Poverty is when you don't have access to anything, either your rights, either education, health, or even justice. Because it's only poor people that end up in jail because they have nobody to defend them. Look at the people, most of the people are awaiting trial. They are only awaiting trial because they are poor. If they were rich or somebody else's father, somebody's brother, sister's uncle, they'll probably be out of jail in a smack. But what is happening is that there are so many people that have been excluded from education. The statistics. From health, we know the statistics, either by accident or design. Doctors are on strike, the facilities are not there, NEPA is not working. Those we are excluded from education, you're excluded from health, access to justice. The relationship between the police and the Nigerian citizens is not at the best as it should be, and that is depriving them from that. So all that includes, and where one is rich and you can access all those things, you can access justice, even at the detriment of the system at times. You can access security, education. You can send your kids anywhere.
All right,
the same.
We do have a report which chronicles the health sector, but we'll come to that in a minute. But just before we come to that report, how important or not is this one, where a government leaves or supposed to, when they hand over to the next one comes with an entirely different program and policy? I mean, I have people here suggest, why don't we have this national plan, national policy, so that whoever comes in at whichever level, state or the federal, you just develop and say, look, this is what the people want. Just key in and then catch on with it.
Well, it takes it takes political maturity to be able to do that. And I think, this is where we need to look at good examples to be able to know, or look at precedents. And I have to give an example of Lagos State government. Lagos State government has just enacted a 25-year development plan, 2012, well, not 25-year, 12-year, 2012 to 2025. They just signed off on it. And what that does is to bring in all the development efforts together in one page in the health, education, and the sectors which they operate. Documented that, and I think it's going through some legislative process. But the governor signed off on that. So, long perspective plans like that are well thought through and well documented, right, that are included in the transition notes, handover notes, and like that, are things that can solve some of these problems. And of course, people need to elect mature people into government, people who are knowledgeable, people who know that the consequence is not about an individual or thing like that. And of course, if you've been measuring, as we say, if you've been measuring a trajectory, and you know that this thing is working and is working well, then there's the evidence for you to go ahead and do just that.
All right, let's take a look at that one on health now.